There's an epidemic of liver problems that I'm starting to see all the time that is unrelated to alcohol consumption. I was first very surprised when I saw a whole host of these young children that were coming in, and they were coming in with non-alcoholic fatty liver disease. And for the longest time, I was puzzled as to where it was coming from and how could 12-year-olds, 14-year-olds, 15-year-olds be coming in with this fatty liver? Where was it coming from? What was going on? And most importantly, how could we potentially improve this condition? Now in this video, I'll share a little bit more about what I'm seeing, what some of the early signs are, as well as traditional herbal formulas that have been shown to improve this condition. Hey guys, I'm Dr. Alex Heyne, board licensed doctor of acupuncture and traditional Chinese medicine, and author of the health book, Master the Day. So let's jump in. Now, it was probably about 2 years ago where I started to notice this epidemic of these young children coming in with fatty liver. Now, it wasn't what they were coming in for in particular. Some of them did have acid reflux, others of them were just very overweight, and as part of our discussion about the symptoms that we were treating, we were also talking about maybe trying to find a way for them to get a little bit fitter, because starting so young and being so overweight was quite risky and very hard to fix. Now, one of the incidental findings that they had when they would get their labs done with their PCP is that they would find that they have fatty liver. Now, it's called non-alcoholic fatty liver disease to differentiate it from the kind related to alcohol consumption. And the only other correlation that I was noticing was that, yes, these kids were primarily lower income and they were typically very overweight, unusually overweight for kids so young. Now, what I found was that many of these kids had been consuming a diet high in processed foods, and in particular, sugars in the form of high fructose corn syrup. So these kids in particular, the main correlation was that they were consuming lots of soda on a daily basis, several cans, or even some of them, even a liter a day of soda, if you can imagine. Now, the liver has many different kinds of functions in the body, but on the detoxification side, one of the things the liver does is it helps filter the blood. So it filters, for example, alcohol, drugs, medications, even herbs. Now, when it comes to non-alcoholic fatty liver, what we're seeing is that it occurs when there's an excessive buildup of fat in the liver cells. And while it is normal for the liver to have a small amount of fat, basically fatty liver is diagnosed when the fat accounts for more than, let's say, 5 to 10% of the liver's weight. And if it continues, it can progress and lead to other more serious issues with your liver. Now, the most important thing to remember in terms of non-alcoholic fatty liver is that it is mostly linked to obesity, type 2 diabetes, generally being overweight, high blood sugar, cholesterol, that kind of thing. But what are some of the early signs of this? The problem is that the earliest signs of this, you will not be able to tell just observing your own body. But there are 4 or 5 signs that sometimes people notice early on that can be very diagnostic here. One symptom is fatigue, basically feeling unusually tired or weak, which can be due to the liver's reduced efficiency. Sometimes the second sign is that people notice discomfort in the right upper quadrant of the body. The majority of the time when people actually feel that, it is related to your gallbladder. So distension, pressure in the right upper quadrant or rib side. Occasionally it's paradoxical and it shows up on the left side. Sometimes sourness or bitterness after meals, or commonly you'll notice pressure and pain 30 minutes after your meal, for example. The third sign is, for example, weight gain. And weight gain, particularly around the midsection, you almost always see with people who have non-alcoholic fatty liver, because almost inevitably, to eat the number of calories and the quality of food that damages the liver, for such a young person in particular, but even as you get older, lots of people will have it or show it, it is very highly correlated with people who are gaining body fat in general. So if someone comes in and they are clinically obese, I assume almost guaranteed they have fatty liver. Now, the fourth sign here is nausea or decreased appetite. When we talk about the gallbladder and liver, they have a closely shared relationship. And lots of the time when people have fatty liver, they also have acid reflux, they also have gallbladder problems, they also have issues with enzyme production in the pancreas. So there's a whole host of other issues that are the canaries in the coal mine that will come before you necessarily have fatty liver itself. So sometimes it's not always easy to know where the signs and symptoms are coming from. For example, lots of the ones I just shared could be related to a dozen other physiological pathways or organ dysfunctions in the body. What I would recommend is check out the free quiz we've put together below this video. And basically what that quiz will help you figure out is go through your symptoms and learn, according to traditional Chinese medicine, what are the most likely causes of those symptoms. They may be a little bit different than what you've seen in conventional medicine, but we've taken the time to hyperlink those videos to other videos that we've shot that will help you sort of unpack a lot of what's going on. But what do we actually do about this? because in traditional Chinese medicine, there are formulas that have been shown scientifically to improve liver function and improve fatty liver. Now, one research paper here in a journal called Gastroenterology, these researchers were highlighting the effect of one formula. They said that this formula, called Xiaochaiyutang, minor blueperum decoction, has been shown in animal models to prevent liver injury and promote liver regeneration by inhibiting oxidative stress in hepatocytes and another kind of cell here. And most importantly, in human trials to prevent the progression of cirrhosis to HCC, which is hepatocellular carcinoma. So this formula can actually prevent the progression of certain liver pathologies into something more serious, which is pretty special, and that's a pretty big claim. Now, there's another paper here that I want to bring up because it's useful too. This other paper mentioned that a phase 2 trial at Sloan Kettering Cancer Center found that this formula may improve liver pathology in patients with hepatitis C who are unable or choose not to receive interferon therapy. Now, in this particular trial, 24 subjects were given 2.5 grams 3 times a day for 12 months. After 12 months, 38% of them had improved liver histology on fine needle biopsies. They took a sample of the liver cells, and 67% had reduced AST levels and 75% had reduced ALT levels. These two, AST and ALT, are liver enzymes that are very important to track in the case of liver functioning or liver problems. Now, let's say you can't see a licensed TCM practitioner, and let's say you can't see me. What do? Rather than ordering formulas on the internet, which I would not recommend, the 3 biggest things you can do to help improve the functioning, and as the research suggests, there's a good chance that you can reverse many of these things, depending on how advanced it is. Eat more of a plant-based Mediterranean diet. Stay away from processed foods and soda of any kind, sugar if you're able to. And basically, try to introduce more sauteed vegetables. Focus more on like olive oil as a sauteing oil, more vegetables, more whole grains, that kind of thing. And that will naturally be a lower calorie diet anyway, which will improve your insulin sensitivity, will improve the functioning of your gallbladder, your pancreas, your liver, lots of the digestive organs. And do that long term, right? Months to years. And you can improve many of these biomarkers of your actual liver functioning. So don't forget, guys, I work with a limited number of new patients every single month in my clinic in Los Angeles or virtually via telemedicine. If you want to reach out, you can just go to dralexheyne.com/clinic, or the information for my clinic and our contact number is right below here. And before you go, I have another really useful video on liver functioning and other formulas, herbs, and supplements that can help right up here.